Today's complaint, it's about patients that they come to see us. They know their story. They come to see us for another solution. We give the advice. We tell them what's the best way to go. And anyway, they say, I'm not going to do it. I'm just going to mention a case. There was a patient that came to see us that it was recommended to have braces before placing an implant. He showed up. He told us, well, I'm not going to go through braces anymore because it was 3 years and they didn't perform it right. But it was a patient that had a tooth, a front tooth. It was a number 9. So what happened? There was going to be a big gap there? No, it was going to be a short gap. And one of the recommendations was to do braces, orthodontics, and then later on perform the implant. Patient said, no, we're not going to do no braces. We're not going to go back to that treatment option that is going to take another 2-3 years. We want an implant. So remember that us as doctors, we need to know all the brands, all the sizes, and all the solutions. But we're not gods. What we do is that we just give the best solution. And even if you're going to give a narrow implant for a solution for a tooth number 9, well, it's something that previously we do it, we have it signed and written and agreed by the patient. But yes, not because it's a narrow implant or if it's a wide implant, there could be a rejection. Remember, implants don't fail, the bone rejects them. But if it's rejected and there's no other solutions, because we can also on a number 9, we can recommend a flipper, we can recommend a bridge, and you put a narrow implant and it's signed and agreed by the patient. And 2 years later, you start to have problems and they tell you that everything was wrong. Well, that's unfair because remember that us as doctors, we give solutions. We don't want the patient to be struggling or with pain or with problems. If the implant is rejected, remember that implants are rejected no matter where you live and no matter where they place them. At the end, doctors try to do their best always. Us, in our clinic, what we do is we give warranty on what we do, on materials, on procedures. And if something goes wrong, because something can go wrong, yes, why an implant can be rejected, but not because of us. Every time we put an implant, it's a screw retainer to 50 newtons. And if the body rejects it, it's not the doctor's fault. It's something from the body. So if you have a rejection from the body, at the end, we need to give that support. But yes, you need to come. But if you don't want to come and you say that everything is wrong, well, at the end, there's a lack of communication there because everything was signed, written, and we advise. These type of cases can certainly happen. At the end, it's a teamwork, doctor-patient, and everything needs to be informed. Everything needs to be written. That's what we do here in our office. I'm Dr. Assad. Thank you.